Can you hear me now?
Yeah, now I can hear you.
Oh my God. I did that whole introduction and couldn't nobody hear me.
I didn't hear you. I don't know if anybody else did.
Let's see. So let me see. Nobody's chatting. Oh my God. So I am going to make sure. Let me go back here.
Yeah, now I
And
can
why
hear you.
aren't we both in here?
That whole introduction, could nobody hear me? I didn't hear
Okay,
you. I don't know if anybody
so
else did. Let's see.
I'm trying to add you to the
Nobody's chatting.
camera.
Oh my God. So I am going to make sure. Let me go back here. Yeah, now why aren't we both in here?
Why is it not showing both of us?
Okay, so let's see. So
I'm trying to add you to the camera.
Oh my God. So I am going to make sure. Let me go back.
I don't know why it's not adding you. Let me see.
Why is it not showing both of us? Okay, so let's see. So I'm trying to add you to the camera. Oh my God. So I am going to make sure. Let me go back.
Okay, this is driving me crazy. So, Dr. Eva, give me just 1 second and
Okay.
see. Let me see why it's not allowing me to share you, because it shows me and then it shows you, but it's not letting me. Oh, there we go. Okay, let me see. I just had you. Wait a minute. Wait. Okay. Oh my goodness. You see that? Can you see me now?
Yeah. Okay.
I'm like, what in the world? Okay, so I'm going to start this all over again because I want to make sure they hear all the wonderful things that I just said about you. Okay.
Okay. Thank you. Yeah. Yeah. I'd like to hear too.
Yes. Well, I am so excited, everybody, to have Dr. Eva as my guest on today. And I was telling you all before I introduced Dr. Eva is that I've been absent for the last couple of weeks because I needed to take a break. Many of you all know I am in the executive coaching program right now with University of Texas at Dallas, and we graduate in August. I'm so excited. So I've been in that program for almost a year now. And in the interim, I was also part of the Be Well program at Babson College, which is a Black Women's Entrepreneurship Leadership Program. I was doing that in conjunction with doing the executive coaching program. And I was also part of the 10,000 Small Business Initiative hosted by or put on by Goldman Sachs, in which I met Dr. Eva in. Yes. So we were in cohort number 22 and met a lot of great entrepreneurs there. The best experience ever. And I was so glad to bring Dr. Eva on so we can talk about what she offers to the community. And I was trying to say before that you all couldn't hear me. If you have business besties, people that you know who are in business, invite them to this broadcast right now. They need to hear this. If you know people who don't have insurance, but they may be working, but can't afford insurance, they need to be on this live stream right now. They need to hear this information. So I am going to tell you a little bit about Dr. Eva, and then we will start the show. All right, so let's do this all over again. Dr. Eva, now, how do you say your last name? I got Mackey, but how do you say the last one?
Meyrat.
Meyrat. Okay, Dr. Eva Mackey Meyrat was born in Austin, Texas. Much of her childhood was spent abroad with her mother, but when not traveling, she was in Austin. She did her undergraduate degree at St. Edward's University in Austin and moved to Galveston to attend medical school at the University of Texas Medical Branch. Dr. Eva did her residency at St. Anthony's Family Medicine Residency in Denver, Colorado, and has received her board certification in family medicine. Dr. Eva has been practicing family medicine in the Rockwall, Rowlett, Garland, Mesquite area for the past 17 years. Prior to opening her own practice, she worked for the Baylor Family Health Center of Mesquite. Dr. Eva's dream is to provide high-quality primary care that focuses on the needs of the patient and eliminates the bureaucratic hassles that plague our healthcare system. That's why it's important to listen to this discussion today. Dr. Eva strongly believes that quality care should be affordable and accessible to all patients, regardless of their insurance status. She left Baylor in 2017 to pursue her dream and open Rockwall's Gym MD. Dr. Eva enjoys cycling, running, skiing, and crocheting. She also loves to spend time with her 4 great kids and her husband. Dr. Eva volunteers for the International Cultic Studies Association, ICSA, where she helps individuals who have escaped from coast to heal from the damaging effects of group psychological abuse. Thank you so much for being my guest, Dr. Eva. I'm so glad to have you. If you have anything else to add to that, please do so. So glad to have you.
Thank you very much for having me as well. Yeah, I think so that sums up the basics.
Now, how do we meet?
Oh, Goldman Sachs.
Yes. Now, let's talk about that program. Now, wasn't that like the best experience ever?
Absolutely. I highly recommend it for small business owners. People like me who know the business they're in. I know medicine, but I don't have experience with running a small business. And there's a whole skill set that I needed help with. And that was a wonderful program. So I do highly recommend that for all small business owners.
Well, I am so glad you're right, because I mean, I enjoyed every aspect, and I have experience running a business, but I mean, you're talking about taking it to another level. That's what the program did for me. And not only just learning, just meeting people like you in the program and hearing what you're doing and how you're doing it, because then we could collaborate and we get interested in each other's business and say, oh my gosh, I didn't even know this kind of stuff existed. And I remember when you were speaking, it kind of blew my mind about what you did. And I was like, wait a minute, what did you say? And so it started my mind running about, oh my gosh, she has something really great here that people need to hear and understand, and also the why. So before we get into all of that, I want you to tell people, why did you choose medicine as a career path?
Well, medicine is something very meaningful. It used my natural and innate talents and allowed me to help people. I'm good in science. I'm good in math. I have that kind of brain. But I wanted to be able to use those skills. I wanted to apply those skills in a way to really make a meaningful difference in people's lives. And so medicine is an applied science. And so that really appealed to me. So I wanted to help people.
Oh my gosh, that is so awesome. Well, I am so glad that you did, because what you're doing is taking this whole healthcare, being affordable and available to everyone, to a whole nother level. So I want you to first tell us what the program is, and why did you decide to make the change of leaving somewhere like Baylor? Because we hear Baylor, we're like, wow, Baylor. And then say, you know what, I'm going to leave something like that to do my own thing. What set us up the whole premise on why did you do that?
Right. Yeah. Baylor is a big name. And when I got that job, I thought I had gotten my dream job. I thought that was it.
Yes.
But
yes, indeed.
As we all know, and as I'm sure you know from the patient's perspective, the healthcare system is broken.
Yeah.
And patients are paying more and more to get less and less, to get just poor quality care. Patients feel that if they don't have insurance, they don't have access to a doctor because it costs too much to see a doctor. And then when they go to the doctor, they get hit with surprise bills, fees. There's no price transparency. They never know how much anything is going to cost. It's just a bunch of tests gets ordered, and later on you start getting bills for hundreds and sometimes thousands of dollars.
Yes.
And people feel like they don't have enough time with their doctor. They'll wait months to get an appointment with their doctor that is like about 5 minutes. They have a long list of problems, and they're told that they can only deal with one problem in that visit, and they've got to reschedule to talk about the rest of the things they got to get addressed. So that's just poor quality care for an incredible amount of money, and no price transparency. So, and from the physician side, it's horrible as well. I mean, we are pressured to see as many patients as possible. We're told that we have to squeeze as many patients as possible into a day. And we are also told that we have to spend our time in plugging in data fields into the electronic medical record system so that we will get reimbursed by insurance companies and Medicare. So we are burdened, the physicians are burdened with a tremendous amount of busy work, which is why you go to the doctor now and you feel like your doctor doesn't look at you, they just look at their computer screen.
Yeah, because they have to do both of them. My
because
goodness.
I mean, trust me, those doctors hate that. They hate it as much as you do. They would much rather be talking to their patients. They'd rather have time for the patients, and they would rather not be looking at a computer screen. But this is it's very authoritarian, and they tell us we have to do this. It's something, you know, that people doctors are penalized for not doing it. Their salaries are reduced if they don't do all this. They're under horrible pressure, and so it's a bad system for both. So I knew my frustrations as a physician, that I wasn't able to take care of patients like I wanted. I didn't have the time for them. I would order tests and I couldn't tell them how much it cost, which I thought was ridiculous. That it was embarrassing to me that I couldn't give them a price on the things I was ordering, and the patient's needs weren't being met. And it's really, people may not know it, but doctors are really upset when they can't take care of our patients. We went into this field because we wanted to help people, and we have the skills, we have the knowledge, we know how to do it, and we know what should be done. But our hands are tied by this system, and we can't do it. It's been called moral injury, when we know it hurts. It's bad. Doctors are depressed. Doctors are really unhappy with their careers. Every single doctor I work with at Baylor complained about it. Everyone. Nobody liked it. So I decided that instead of complaining about it, I was going to find a different way to do things.
Oh my gosh, that's what I was going to ask you. So what did you do next? You said, forget this, I'm packing my bags. Big Baylor name or no, I'm going to do my own thing. And you know, it's interesting that you say that, because when I think about my doctors and the doctors I've been through the years, they are kind of rushing you in and rushing you right out the door.
Right.
And it's like, you cannot ask for anything else. You have to see them for that one thing. And if you talk about anything else, go and make another appointment to come back. And
that'll
it's like, okay, that's an inconvenience. Yeah. Oh my God.
It's so frustrating. And trust me, they don't like doing that any more than you like having it done to you.
Wow.
It's the system. We are both stuck, both doctor and patient alike are stuck in this horrible system. But it's up to us, the physicians, to guide us out of this, to find a way out. I mean, we have the power. The problem is most physicians feel powerless in this system, but we have to regain the power. And that's what I did with the direct primary care model. So I spent a lot of time thinking about this. I was unhappy for a long time in my job, but and I knew a lot of people who quit working for Baylor like I was, and go to they would work for Methodist or Presby, and I would ask them if it was any better, and they'd always say no. It's more of the same. And so
it's the same, it's a different name, same stuff.
Same stuff. Yeah, same stuff, different brand. So I was like, well, I don't want to do that. I don't want to leave this for something just as bad. What can I do that would be completely different? How do I just completely rethink this? And so I spent a lot of time thinking, and I decided that there's three things that were really corrupting the delivery of medical care. I said it's insurance companies, Medicare, and large hospital systems.
Wow.
I thought none of those things have any place in primary care. Primary care is simple. The vast majority of what I do, it requires a good physician, but it doesn't require expensive equipment or a lot of overhead. It's just me and my stethoscope and my otoscope and a blood pressure cuff. I mean,
yes,
that's it. Like, my most expensive and complicated piece of equipment is the EKG machine. It doesn't have to be expensive or complicated.
Yeah.
It gets expensive and complicated when you add those three things: a large hospital system, insurance companies, and Medicare. So I thought, well, how can I practice medicine without all those three things, because it's like we've all been sort of brainwashed into thinking that there's no other way, that you have to do those things, that you have to go, you know, just for your regular primary care appointments, we feel like we have to go to some big name like Methodist or Presby or something. And we feel like we need insurance for that. But I mean, just think about it. Like, you know, when you do routine work on your car, like an oil change, do you use your insurance? You don't. You save your insurance for the catastrophes, the car wrecks.
That's right. You're right.
You don't use it to fill up your gas tank, and you don't use it for your oil change. Well, primary care is like filling up your gas tank and your oil change. Okay. So this is, you don't need insurance for this. You need insurance if, God forbid, you get cancer.
Yes.
But you don't need insurance to see your family medicine doctor. So in the direct primary care model, what I do is, instead of billing insurance for office visits, I have an affordable monthly membership fee, and that allows patients unlimited access. So they can see me as many times as they want, and they do not get charged for office visits. We can also do telemedicine appointments, and I was doing telemedicine before it was cool, before we had COVID.
Right, and it became a thing.
Now it's a thing. Yeah, now everybody's doing it. I'm a trendsetter. Anyway.
Right, yeah. That's my Eva.
Yeah.
Yes, love it.
So telemedicine, and the patients also have contact with me, direct contact with me through email, and they can also text me. So the access is open. And people often ask, okay, why a membership fee and not just a fee for service? Like, you know, I just pay for an office visit. Because the problem is the fee for service model, what it does is it pressures me to cram as many patients into a day as possible. So now we're back to 5-minute appointments where you can only talk about one problem.
Yeah, exactly.
And now we're back to a 3-month waiting list to get in to see me. But a primary care relationship, primary care, it is a relationship. I mean, let me just put it that way. The relationship with your primary care doctor. I mean, just think of it like in the old days, the old country doctor who knows you and your grandma and your husband and your kids and everything about you, might have delivered you, or, you know, I mean, that's what a primary care doctor is supposed to be with. I mean, this is somebody who's part of your community, who knows you and your family. And it's an ongoing relationship, and it doesn't fit into a 5 or 10 minute office visit. It's something fluid and ongoing. So the membership allows me to be able to take care of you in a more fluid, ongoing way. You know, we can talk on the phone, we can email, we can text. It doesn't have to be confined to these 10, 15-minute office visits. And you can just shoot me a quick email if you've got a quick question. You don't have to schedule an appointment for it. It's so much more natural and easy, and people get so much better care. And I get to know my patients so much better. You know, when I left my previous position with corporate medicine, I had patients who had been seeing me for over 10 years. And some of them followed me to my new practice. And in my new practice, I thought I knew them because I had been seeing them for 10 years. But in my new practice, I got to know them in ways that on a whole new level. And I realized just how artificial those little time slots are, and how little you can actually do with those little time slots. I mean, doing the membership model for primary care really makes sense. So,
oh my gosh. I mean, because when I'd heard it, my mind was blown, because I was like, who would ever thought about it? And those are my people out there that are business owners. You really need to be listening to this, because if we talk about if a business owner, we think about a subscription model. This is the same thing, but for your health care. And there's another way, because one of the things that we get a lot of questions about, especially in the resume writing groups, the memberships I'm a part of, is what's the best healthcare? Who is your healthcare? What insurance are you going to use? Because that's always the hunt, especially those who are transitioning from corporate America to doing their business full time. They're looking for somebody, actual healthcare for themselves. And then you have people who are career professionals, but for some reason, they're not with a large corporation who's paying for their insurance, and they're paying out the kawusu for something that they probably, like you said, it's not a catastrophic thing that they need. They just need something when they need to, hey, you know what? I got this rash. Can you tell me about this, Dr. Eva? And be able to call you up. And then what blows my mind is that you said they could even email you. What?
Yeah.
I can't even think about emailing my doctor.
Oh yeah. You can just take a picture of your rash and email it to me or text it to me and say, "Hey, what's this?"
Mm-hmm.
and
And you said text. Oh my gosh, this is unbelievable.
mhm.
Mm-hmm.
Yep, for sure. And we'll probably ask you a few more questions. And a lot of times that's all it takes. I mean, sometimes I can figure out what it is just from a picture. Now, sometimes people do need to come in, but
Mm-hmm.
at least I can try. You know,
Mm-hmm.
in this model, I don't need you to come in every time. I only need you to come in sometimes. So if I
Mm-hmm.
can't figure it out from
Mm-hmm.
a text or an email, then I'll say, well, I really don't know. Why don't you come in and let me look at it?
Mm-hmm.
And then you can come in.
Oh,
But
that is absolutely fabulous.
and
And
then
you
with
know
the
what? Go ahead. Mhm.
Oh, I was going to say with the membership, so I try to bundle as many things as possible into the membership so that there's not a
Mhm.
lot of extra fees on top of that. So the vast majority of what I do is included in the membership. So that's
Mhm.
things like urinalysis, strep test, flu test, EKG, vision screen, hearing screen. Like I include all that, procedures if I need to remove a mole, if I need to open up an abscess. Everything I can is
Wow.
bundled in there so that there's no surprise fees. And then for other things that you need, like blood draws, we have that stuff at rock bottom. So when you opt out of Medicare and insurance contracts, you can negotiate for much lower prices on a lot of things, and I pass that on my patients wholesale. Like for example, a cholesterol panel is $5, whereas at a regular doctor's office you'd be paying $100,
Yes,
or
indeed.
a hemoglobin A1C is $8, or a TSH screening for thyroid disease is also $8. So it's
Wow.
amazing because if you're opted in to insurance and Medicare, then the lowest price you can charge anyone is the lowest allowable Medicare price. But that's considerably higher than $5 for a lipid panel. So
That is
I do
amazing.
everything I can. So I'm your physician advocate. So I I work for you on so many levels, and that's what the membership buys too. You're buying not just you're buying a physician advocate, not just the availability of having a doctor you can see. You're paying to have somebody who's always going to be on your side, always looking for the best deals for you, always trying to get you the best care. So I shop around. I just get you the best prices on imaging, on specialists, things like echocardiograms. It's amazing what I can do. I can get you stuff just a fraction of what you would otherwise pay.
And that is just absolutely mind blowing. I am so glad that we're talking about this because, again, like I said, so many people need this. And then I want to go back to when you're talking about the career because this is, I'm all about careers. And a lot of times people look at doctors and say, oh, wow, I wish I could be a doctor because they only think about the financial. I want to earn a lot of money. But they've got to
Mm-hmm.
realize a career is a career. And if you're not happy in your career, then it's something to do about it, to do something about it, and you can change your situation. And that's what I applaud that you did. You
Mm-hmm.
changed your situation. Yes, you were there for a long time, but you thought about it for a long time and say, how
Mm-hmm.
can I do what I love to do
Mm-hmm.
without all of the stuff that's going on and create
Mm-hmm.
something for myself while I'm still doing my passion and still earning the income at the same time. And I
Right.
mean, to me, that's just mind blowing to be able to do something like that. Now, I
Yeah.
want to ask you about the direct primary care. How far of an area do you serve?
So my patients come from all over Texas. Anyone in
Mm-hmm.
Texas. So
Mm-hmm.
I have to limit myself to Texas because my license is for Texas.
Yes.
But
Mm-hmm.
because I can do telemedicine for a lot of things, I
Mm-hmm.
have patients who live as far away as Odessa, and
Mm-hmm.
that's okay. I mean, she's come to see me a few times, but most of our visits are just telemedicine. So
Mm.
anyone in Texas.
That is absolutely phenomenal. So y'all, anywhere, look, here I am saying y'all, this Chicago girl saying y'all. But anyway, y'all, if you need this, please make sure that you're reaching out because and watching this and figuring out. I didn't know that it costs that less to be able to get some of those things, but because of all the layers, the overhead, because you got to pay so many different things, it
Yeah.
increases exponentially. And think about, I'm thinking about this too, Dr. Eva. A lot of times people have insurance where they have these huge deductibles that they
Mm-hmm.
have to meet
Yes.
before their insurance even comes in. How do
Right.
you explain the benefits of what you do to those who have that issue?
Right. So I can really help those people. So a lot of times those people are afraid to go to the doctor because they know that they're going to get hit with a bunch of surprise fees. And
Mm-hmm.
here's something some people don't know is that when you have insurance, like those high deductible plans, the insurance actually inflates the price of everything that you do. So I can help with people who have insurance plans that have high deductibles and don't cover much. I mean, those people are paying an arm and a leg for really simple things, and I can get them much better quality care and greatly reduce the cost of medical care for them by giving them access to less expensive labs and imaging and other things like that. So I can really help them. And if they have an HSA account, they can pay for their membership in my practice out of their HSA account. So their insurance basically in that case is covering their membership in my practice, but they have a physician who's always able to see them and take care of them and who always will advocate for them to get them the best service possible at the lowest price possible.
Now, let me ask you this. Now, with HSA accounts, you could, anybody insured or not working or not can have an HSA account. That's health savings account. Is that correct?
Well, so my understanding of a health savings account is that it's something that a company sets up for their employees. So, and that it's offered as a benefit. I'm not really I'm not an insurance agent at all.
Okay.
And so I could be wrong about that, but I mean, the only place I've encountered HSAs is with people who work for companies that offer that as a benefit. But a lot of times those are the people who have an insurance plan that really doesn't cover much, and they're trying to figure out how to get better access to care. And so this is a solution for them, and they can get it basically paid by their insurance if they have the HSA account.
That is absolutely phenomenal. So you all listen to that. If you have an HSA account, look into that. And this is so timely because now that if we're in June, and then open enrollment is usually what, October, November, right?
Yeah.
So these are the things that they should be thinking about. So what I really want to do, Dr. Eva, is bring you back around open enrollment time. Do you have anything for stuff like that? Say like an open house or anything like that? Because I want you to come back and talk about that.
Yeah. So I would love to come and talk with people about that and just kind of let them know what their options are. Yeah.
Yeah, because they really need to understand that there's other things out there besides what all we know. We're just so used to the same old system, the insurance. And then when we lose our jobs, we're panicking. What are we going to do?
Yes.
And even all my people out there who unfortunately have lost their jobs have folded up or what have you. This is another option to make sure that you're taking care of yourself where you can afford it as well. So do you have clients or patients like that as well?
Oh, yeah, absolutely. I do, for sure. Yeah, people who have lost their jobs and are looking for options. Yeah, I can help those people as well. I mean, obviously, you don't need insurance to be part of my practice. I recommend that you cover something or that you carry something for catastrophic care. I recommend that. I don't require that. I'll see anybody regardless of their insurance status. I do have I do have some suggestions for people who are needing some catastrophic care. It kind of
that's what I was going to ask.
Depends on I do have suggestions. Now again, I'm not an insurance agent. I actually have an insurance agent that I work with to get people some great solutions. But for a lot of people, they will do well with a health share, which is a little different than insurance. But it's a system where people pool their money to cover catastrophic events for each other, catastrophic medical bills and stuff. And that can work really well and be significantly less expensive than an insurance policy.
Wow. And people just don't know this information.
Yeah,
they just really don't.
Know. Yeah.
They're just thinking of the same old traditional. And it's so funny that we're talking about those unexpected bills because I remember the news would have those highlights about different people getting hit with these major bills, had no idea about.
Right.
Do you know why the healthcare industry is not transparent with their pricing?
Oh yeah. It's insurance.
Okay.
It's because of the insurance companies.
Yeah. Wow.
Because the price of a service is a very complicated equation it's something that is negotiated between the healthcare organization, so people like Presby, Methodist, Plano, and the insurance companies and Medicare. So it's a very complicated thing that is negotiated between them. And the healthcare organizations will negotiate for the highest price possible on these services, okay? Because they want as much money as possible out of the insurance company. But then the insurance company has their way of not paying it. So they don't really mind having these huge claims made, having these huge claims submitted, because they have ways to refuse most of it by always blaming the doctor for not using the right diagnosis code.
Yeah.
Like, how am I supposed to know the right diagnosis code when there's so many different insurance companies? I mean, there's no way that I could possibly know what diagnosis code they want me to use in these situations. And so they'll always come back and find some reason to deny the claim, and then and they'll or maybe they'll approve it, but they'll pay a portion of it. So they'll only, so their definition of approved means they pay 25% of it or something. So then the rest of that huge bill gets passed on to the patient. Okay.
Ooh.
I mean, like, for example, so surgeries are a good example. I work with cash pay surgery centers to get people surgeries for reduced rates, cash pay. And the surgery centers have a bundled fee. It covers the doctor doing, so the surgeon doing the procedure, the anesthesiologist, and the facility and pathology. So, for example, a gallbladder is $5,000. I had a patient go to the hospital with an insurance plan and get billed $80,000. Okay, that's the kind of price inflation I'm talking about. And then, and then you get and then you've got to pay your $5,000 deductible.
Yeah.
And then the plan, then it's an 80-20 plan after deductible. She pays 20% of this hugely inflated bill, and the insurance pays 80%. I mean, so, but wait, where's the better deal? I mean, that's not a good deal, So she had insurance, but it didn't. It's just, it's a racket. It's a racket.
It's exactly it. That's exactly it's a racket, and it's unbelievable that kind of happens. And people should know to shop around to make sure that they are being not taken advantage of, and that's why what you're doing is so important.
But the problem is, you can't go to a hospital and ask how much something is going to cost and expect to get a straight answer, because it's this complicated equation. It's, well, whatever we've got negotiated with the insurance company, and then it's whatever portion of that they decide to pay, and then you'll be stuck with the rest of it. And there's no way for anyone to tell you in advance what that is. I mean, it's a ridiculous system, and it's horrible. It's utterly ridiculous.
Oh, wow.
And so
I'm thinking of so many friends who can use this.
So this just cuts through all of that insanity, just cuts it out, Let's just get back to what this is all about, Let's just take care of the patients and charge you a fair fee. That's it.
That's it. And that's it. And I love that about your heart, because it's all about taking care of the patients. And those are the kind of doctors that we want, that want to take care of us without all of the red tape and all of the things that are supposed to happen. Because if I'm sick, and this is another thing, when you're so sick, you're not really thinking about all of the stuff that goes on behind the scenes. So you get well and you get the bill. You want someone who's going to be honest with you. You really want someone who has your best interest at heart and really want to take care of you while not breaking you at the same time financially.
Yeah, right. You feel cheated. Yeah. And it's so hard. That's where the moral injury comes in for doctors, because doctors, the physicians are not the one responsible for these insane prices and the bizarre negotiations that go on. We're not the ones responsible. We're the ones who hear about it from the patients. They're the ones who kind of come to us with that giant bill and say, where the heck did this come from? And we're just like, I don't know. It's horrible. I don't know. I wish that I could tell you, and I wish that I could fix it.
Wow.
But we can't. I mean, until you step away from the third-party payers, we just don't have any control over that. And so this is the way for me to get back control over that. And if patients can come to me and let me work as their advocate, then I can help them to figure out better, more affordable options.
And I love that because, when you think about it, and I think that's the perception. A lot of people think it is. That's how much doctors cost. So it's
It's like,
almost
no,
that they just accept it. And I like that you're saying that it's not
it
you
is
all,
not
it's
us.
all the other bureaucracy that goes on behind the scenes that
It
you
is.
have no control
It
over.
is. It is not us. We are. We are
Wow.
not doing that, and we're not the ones getting all this money. It's all going to the administrators. I mean, there's
Yeah.
so many. I mean, just think about it. When I worked for corporate medicine, I had like 5 employees in my office just working on insurance claims. Plus, there was literally a whole building, a whole office building of people in downtown Dallas working, negotiating with insurance companies and Medicare on our behalf. I mean, literally a whole office building full of people in downtown Dallas. That's where that $80,000 is going, not to the
Right.
doctor. And we're not
Right.
the ones out there trying to charge you these exorbitant fees. It's not us, it's them.
Wow.
And we're just as oppressed by the administrators as you are. And so
Oh.
I want it out. I want it out. It made
I
me so
love
angry.
it. You said, and look at your face, Dr. Eva. You like, I want it out. I'm like, I'm done with this.
For
And I
real,
love
yeah,
that.
because I had to realize, look, this is
Yeah.
my medical license, and if
Yes.
I want to stand on a street corner and practice medicine for pennies dropped in a hat, if I want that to be my form of reimbursement, I can do that. And I
Yep.
don't need this. I don't need these administrators. I don't need this office full of people in downtown Baylor telling me what to do.
Wow. Now that is so powerful that you just said that. And you know what, you all listening to this conversation, just think about that for yourself. Your own, it's all about your integrity and your, like you
Hmm.
said, your moral character you want to keep
Yeah,
intact because
yeah.
you got into this for a reason. And you have to ask yourself, people out there, about your own career. Why did you get into that? What is it that's around you that's prohibiting you from doing what you really truly love to do? And then think outside the box, as Dr. Eva
Mhm.
has done. She thought outside the box. How can I do what I love to do and bring it to the patients an even better way to solve their healthcare issues, take care
Mhm.
of their health, and also at the same intro, because what I think about this, Dr. Eva, when they get these bills, not only are they physically well, they become mentally unwell because they are stressed out now about this
Mhm.
bill. So you're
Yeah.
taking care of even that stress. So it's not just a
Mhm.
physical thing, you're taking care of their mental wellness as well.
Oh, you bet. Yeah, absolutely. Mhm.
Oh my gosh. Now, when they come to you, what kind of referrals do you sometimes need to make? For example, if they come to you and you notice that not only they have something physical, do you have any relationships where you refer or anything like that?
Yeah, so I do. Sometimes I do. Now,
Mhm,
I'll tell you, I do a lot less referring in this practice than I
mhm,
did in my previous practice because
mhm.
one reason why your primary care doctor refers you so often to other doctors is not because they don't know how to deal with your issue. It's because they don't have time. because because you came in with a list of 5 things and they only had time to deal with one, so they had to refer you out for the rest of the 4 because they didn't want you to feel like you were being blown off. They're like, oh, you need
Right,
a
right.
specialist for that one.
Mhm,
Yeah, but
mhm.
that's not true a lot of times, but sometimes
Yeah.
it is. So
Yeah.
sometimes you do need a specialist. So
Mhm.
I have things that I can do. So I use something called Rubicon MD. It's an online platform for specialist consults. So a lot of times the patient doesn't actually have to physically go to see a specialist. I can
Mm.
consult a specialist online for the patient at no cost to the patient and get the specialist's advice and then order the test that the specialist recommends. So a lot of times I can do that,
Oh my
and that
gosh.
saves the patient lots of time and money, and it's a way, it gets them better care. But sometimes people
Wow.
do actually have to go to a specialist. So
Mhm,
I
mhm,
have a lot of relationships. I've been practicing medicine in this general area of
mhm.
Dallas Fort Worth for a long time. I have a lot of relationships with a lot of different doctors and specialists, and so I know specialists who I will take care of my patients for very reduced cash pay prices. Now,
Mhm,
I mean, if they have insurance, so if my patients have insurance, they can use their insurance still to see a specialist.
mhm,
But if
mhm,
they're uninsured, and I have a lot of uninsured patients, then
mhm.
I do know specialists who have some really great reduced cash pay prices.
Mhm. That is absolutely phenomenal. I mean, this is so wonderful. I am so glad that I got you on here to talk. I'm going to make sure my all of my business besties know about this, especially the ones who are always asking about insurance, and tell especially the ones here in Texas, so that they can reach out to you as well. I mean, just a wealth of information. I so appreciate you coming on the show to talk about this very important topic, because healthcare is needed, but it doesn't have to be needed in with all of the red tape, because there's
Right.
better ways to do
There
this.
are better ways. Yeah,
So
absolutely.
how can they get in contact with you?
Yeah.
Mhm,
So they can email me at
mhm,
Dr. Eva. That's dr.eva at Rockwalls. That's with an S.
mhm.
GemMD.com.
Okay, great.
GEMD.com. They can visit my website,
Mhm,
www.rockwalls with an S, GemMD.com. They can visit my Facebook page,
mhm,
Rockwall's GemMD. I do want to
mhm.
mention that it is a great solution for businesses, though, because I have discounts for businesses who want to enroll their employees. And
That's right. We needed to talk about that
yeah,
too. Yes.
yeah,
Tell me a little bit about that before we totally wrap up. So,
yeah.
businesses, listen up. Go ahead, talk about that.
Right. Yeah. So small businesses with less than 50 employees, you're not required to carry health insurance for your employees, but you want to carry something. But traditional health insurance is often too expensive.
Mhm,
But this is a great benefit that you can offer your employees. So this will get them the primary care that they need, and I can take care of 90% of what they need. So you can you can enroll your employees, and there are discounts for businesses, and they can split the cost of the enrollment with their employees. I mean, it can cost them it really, depending on how much the business owner pays for themselves and how much they pass on to their employees. I mean, it really doesn't have to cost them much. I mean, maybe $25 a month per employee. Um,
mhm.
it can be a very affordable option
Yeah,
for
what a nice bonus to
businesses.
add to kind of,
Yeah,
and that's a great retention, attraction and
yeah,
retention for small businesses
yeah,
looking to hire, to be
yes,
able to do that. Say, you know what? I have a health care. It's called direct primary care. And this is something that you can utilize. Oh my gosh, how awesome. Because sometimes
yeah,
small businesses think that they can't compete with the big dogs in attracting good talent, but this
right.
is a way that they can.
Yeah, they
Yep.
can. They
Mm-hmm.
can. This is
Mm-hmm.
a great way to get some health care for their employees.
Now, I do want to ask one last question. I keep saying last question, but I do got another one. Someone just popped in my head. Where is direct primary care very popular? Can people get it all over the U.S.?
So it's kind of a grassroots movement in medicine. It's gaining popularity, I would say, as more and more physicians become frustrated.
Mhm.
There's not a whole lot of it, because uh, physicians really have to have the courage to break out of
Yes.
what they have been brainwashed into thinking they're supposed to do. Uh,
Mhm.
so there's not a whole lot of doctors who have the courage to break out and do something independent. But yeah,
Mhm.
there are direct primary care clinics around the country.
Oh, wow. Okay. And I like that you say it's a grassroots movement.
Yeah,
Now, if a lot
it's
of
a
people start leaving these insurance companies and stuff, they'll start waking up, because it's for the birds, because people, especially people who cannot afford those big bills, it really wipes them out. And I think about our senior citizens as well.
Mhm,
No. And I can't even think about them, because I'm about to be there too. So I'm thinking about
mhm.
my own self. So
Yeah,
yes. Well, thank you so much, Dr. Eva, for
yes,
sharing your knowledge and your experience, and educating us about all of this. Is
yes.
there any parting words that you would like to leave for the audience today?
Well, I just want people to have the courage to think outside the box, to look for new solutions, to uh, to look outside the traditional insurance model to get the care they need, because it is possible. You just have to be open to new ideas and new ways of thinking of things. So and I would love to talk to anybody who's interested in this practice model.
Oh, nice. Now, my last question, which is my signature question, when I say I rock, what does that mean to you, Dr. Eva?
Well, So, so I rock. Well, I'm just thankful that I have the courage that I've had the courage to do what I have to do, to stay true to myself, and to be the kind of doctor that I want to be, and the tenacity to stick with a plan once I have created it, and just the perseverance to keep finding better ways.
Well, that's why you rock, doctor. And I'm so thankful to have you on the show. Thank you so much for being with us. And again, I'm going to have you back around open enrollment time so we can talk about that and get you some enrollments as well. I am so excited to have you on. Thank you so much for gracing us with your presence, giving us your time. You've helped so many people in so many ways, not only from a healthcare perspective, but also teaching us as career professionals on how to have the courage to stay true to ourselves and make that leap when you need to. I applaud you. And yes, ma'am, you do rock.
Well, thank you, Nickquolette. Thank you so much for having me on the show. I really appreciate you having me here.
Yes, ma'am. Thank you all, guys, for joining me yet for another episode. And we will be back again on next week to talk about some great things. I'll tell you all the things that's been going on with me here at iRock. Some exciting things. And in the interim, you all know you rock. Thank you so much for being with me. Bye-bye. Hold on, Dr. Eva.